going to be rolling out the Greater Toledo 2020 Wellcare plans today. And it is a pleasure to have with me Bill O'Keefe, who is a sales educator with Meridian Care / Wellcare. And before we get started, just a couple housekeeping items here. I do have everybody muted, so if you do have a question, feel free to type it in, and we will address those at the end. But with that being said, Bill, it's a pleasure to have you with us, and I'm going to go ahead and get the first slide moving here and have you take over here and let the good folks know what Wellcare has to offer in the Greater Toledo area for 2020.
Outstanding. Thank you, Mark. Good morning, everyone that is out there. Just as a brief note here before we begin, on my end, I'm having a little bit of technical difficulty. So Mark and I are going to kind of tag team blindly going through this presentation. I cannot join on the computer, so I am on phone only. I will be going through my own printout of it, so I'll be telling Mark to advance slides here and there as we go. So if it gets kind of confusing, that's what is going on. So yes, 2020 Wellcare plans, Toledo. Mark, if you can advance to the Meridian Care Wellcare transition slide, please. As of January 1, 2020, Meridian Care, the name will no longer exist. We are transferring everything to the Wellcare brand. It's important to note that if you have any current Meridian Care members, you do not need to rewrite them. It's simply a name change. The contract numbers are all staying the same, and our current Meridian Care beneficiaries will be receiving temporary Wellcare ID cards in October. And then, of course, they will get their permanent ID cards before 1/1. So that's kind of just some news for you about what is happening as far as the brand transition goes as we go towards January 1st. Next slide, please, Mark. As far as AEP, what is Wellcare doing for on the creative side? We have a little mascot called the Wellbeing. And excuse me one second. Did you have the room book?
We have the room, yeah.
For Shiny? Or for pharmacy?
Yeah.
She told me she...
For 11 o'clock.
Hang on here real quick, everyone. Bill will be right back with us. He's having a...
Yeah, I'm having a conflict schedule here, Mark. I'm getting kicked out of my room because there was a scheduling conflict. If you can... I'm going to try to log in from another one, Mark. My apologies. I don't know what to tell you.
I'll keep moving through here, Bill, and then come back and join me on the phone once you move, okay?
You got it. All right. My apologies. I'll be with you shortly.
Sure, absolutely. We'll see you shortly, Bill.
Thanks.
Okay. Let's keep moving here. As Bill was saying, this is a mascot. His name is known as Welby. And these are some of the things that Wellcare is going to be able to offer you, right? They're going to be field ads so that we can leverage well-being. There are templates that are going to allow you to promote plans with benefits, dollar-specific amounts. And there's going to be just an approach done by Wellcare to invest in you folks to be more creative. So with that being said, let's keep moving here. And I think some of the things you're going to like here with Wellcare is the fact that they have an amazing agent support system out there. There are custom point orders. You are going to be able to order your materials directly from Wellcare and get them delivered directly to your door, obviously subject to being certified and appointed with Wellcare. And we here at Assurance Advisors Direct can certainly take care of that for you if you are not. Secondly, I think what's nice, and I think what agents appreciate the most, is we do have call centers available to you, particularly for you folks who are working in the DSNP arena. We want you to be able to call in, get immediate assistance, and be able to assess a client's needs right on the phone with the agent support people to determine their eligibility for a DSNP and or a traditional type plan. I think the fact that we have a number of ways to accommodate you with sales tools, whether it be a mobile scope, we can do paper apps, you can do fax confirmation emails in a file upload. We also have an e-app available to you. There are temporary ID cards available. And the fact that you can go on the website and you can actually track your Wellcare business is important to most agents. So lots of technology involved here. It's an upgrade from the former Meridian Care platform, and we're excited to see that happen because obviously if we can make you more efficient, that leads to more success. Again, PDP enrollments, right? You can send actually a Pearl, which is your own personal URL, to your clients, and those folks can actually sign on, log into that, do their own online app, and you, the agent, are going to get credit for that, right? The other thing, too, is the sales. Hey, Bill, go ahead. Are you back?
Hey, sorry. I didn't want to interrupt there. I am back. I'm going to try and do this from my desk. Hopefully the call center behind me will not be very loud. You won't be able to hear that.
You're fine, Bill. I'm on, Bill, we're on slide number 5, PDP enrollments and sales presentations. And we were just talking about some of the Pearl that's available with the PDP. So if you can
sure.
pick up from there. Again, it's slide 5, Bill, PDP enrollments and sales presentations.
Let's see. Okay. Yeah, so one of the nice things going forward is that agents will be able to have their own personal URL. So that is going to be important when you can't do an agent-assisted enrollment. Okay, so you give the web address to your client, your prospects, whoever. They can use that to get in, and then that application will be bound to your producer number. And it's just a great way to let people do it on their own if they're technically savvy, that type of thing. We still, however, are not allowing the telephonic enrollment or a presentation over the phone as far as the MAPD goes. And the nice thing is, as far as sales presentations go that we have available, they've been streamlined into one presentation for the MAPD and for the PDP. So it's just real easy to use. It's pretty simple. And we can get those to you either in a PDF or a video format, depending on, which method you would like to use. Mark, if you could go to 6, please. I just want to take a second. Just want to take a second to talk about the 2020 ACT, what we call ACT training, the annual certification. If you haven't done it yet and you do it through our portal for AHIP, you can get, we will give you a $50 discount on the AHIP training or class, and the nice thing is there's one certification for Meridian Care and Wellcare. So if you go through that training for the remainder of the year, you would have access to the Meridian Care products. Obviously, they're being phased out as far as the name, but then you would also have access to any state you choose with Wellcare. It's you log in the beginning of the training. You are allowed to click on which states you would like to be certified for, and then it's pretty much a boilerplate training, and then at the end of it, they have some state-specific things. So that's one way to take care of multiple states in one go. And let's see, next slide, please. So the resources for and support for agent success. So we will be delivering materials to your home or your office. As I talked about briefly, the personalized non-agent assisted enrollment URL, another great thing just to send the people to let them enroll on their own and have that application still tied to you. We will be having an agent portal called Agent Connect, and that's something that Meridian Care has been working towards getting for the past 3 years. Wellcare already has one, so we will be utilizing that platform. And this is a great thing because you'll be able to check commission status, application status, things like that. Your book of business will essentially be online for you, and that is a great thing that we just did not have a chance to complete with Meridian Care. So that is a wonderful thing. We do have an electronic enrollment platform. We do have fax confirmation now if you're faxing and paper applications. And of course, we have an online provider and formulary directory. I'm just reading through my notes here. For the electronic enrollment, you can do it, anytime, online, offline, from your desktop. We do have a mobile application as well that you can download that is good for iPhones and Mark, I'm drawing a blank. The other, because I don't have the other platform.
You have Android platforms.
Android, thank you. Yes, I'm an iOS man myself. But yes, we do have both platforms covered as far as that goes. Let's see, slide 8, please. As far as the member experience goes, so we will have a secure member portal. They can log in, create an ID, go in, get all of their information, print out ID cards. Okay, they can change their PCP. Members can look at their claim status. They can look at authorization status if that's what they need to do. Can view prescriptions, view prescription order status, look up costs for medications, costs for services. They could, if there are plan premiums, they can pay them through there as well. So this is a really nice thing for the members to be able to, kind of have a little bit more control and have the ability to look into their own policy and see what's going on. Through this portal, they will also have the ability to ask questions to an online nurse, so to speak. So that is something that you definitely want to talk up to members when you are doing the enrollment. So, Mark, let's move to the next one. Let's get into some of the plan highlights. I will say that this is pending CMS approval. We've submitted all of our bids and all of the information. Again, this will probably be 99.5% accurate. We will let anyone know if things change. And Mark, if we go to the next slide where we have the map of Ohio, we're going to focus on Toledo. So as you can see, we've got the 4 counties there highlighted: Fulton, Henry, Lucas, and Wood counties. In this market, there's just over 130,000 total eligibles. And the current market penetration, Medicare Advantage penetration is 35.5%. Now that would be all carriers across that area. So there's a lot of room there to market and sell Medicare Advantage policies. It is a developing market for us. I'll be brutally honest. We've got Mercy and University of Toledo in our network. There is a big one there that I'm sure you're aware of called ProMedica. They currently are not in our network. That is something we've been working on for a long time. I know it's a huge provider in that area, but I'll just be honest with you, we don't have it yet. We are working on that. The nice thing is, however, all of our plans will have a POS option. So there will be HMO-POS plans, and there won't be referrals required within the network. So that might be something to offset the provider issue we have. Mark, if you could advance to 11, let's look at the plans that we have side by side here. We have the Wellcare Extra Plus. That is going to be our DSNP plan. That currently in 2019 is called Meridian Care Extra. Well, starting this AEP, it's going to be Wellcare Extra Plus. And then we have Wellcare Essential, which currently right now, of course, is Meridian Care Essential. That is our basic zero premium plan. You'll see the numbers there. I don't need to go through all of them as a comparison. The DSNP obviously is going to have different numbers than a regular MAPD, as you can see, especially when we get down to the drugs. The thing to note that both of these plans all have a meal benefit, transportation benefits. The DSNP has comprehensive dental. They both have hearing, vision, and a fitness program. Okay, so those are some things that we hope will set us apart. They both have over-the-counter benefits. Okay, 0 PCP visits, 0 urgent care. Let's see. As far as the dental goes, I'll talk real quick here about the Extra Plus plan. The preventive is $500. The comprehensive is $1,000, basically times 2. So that means they will get $1,000 in maximum comp dental semi-annually. If they don't use it, it's rolled over, and they can get up to a maximum of $2,000 if you're enrolled over 6 months. We will cover one upper and one lower denture every 3 years. No bridges and crowns. And as far as vision goes, $450 annual benefit. That includes unlimited contacts, one pair of glasses, lenses, and frames every 2 years. And for a hearing benefit, we will provide $1,000 annually, and it's one hearing aid per ear for every 3 years. So one hearing aid per ear every 3 years. As far as the essential plan goes, again, this is your basic, zero premium, your basics type of plan. So there's $500 preventive dental. There won't be comp on there. The vision benefit's $200, but again, it's for an unlimited amount of contacts or one pair of glasses every 2 years. And the hearing is a $500 benefit, but again, it will have one hearing aid per ear every 3 years. Mark, if we can go to the next one. Everything that I just said is on slide 12, so let's go right to 13, where we have a benefit called RX for Good Health. So this is our 90-day supply of medications, okay? So we will offer members $0 for a 90-day supply of Tier 1 and Tier 2 drugs from the CVS Caremark medication home delivery. Okay, that's a really, really great benefit. If it's for a Tier 3 or 4 drug, members will only be responsible for a 2-month retail copay for 90 days. Okay, so that's kind of the old 2 for 3, like Meridian Care had. In that grid right there, the tiers and copays, this, of course, applies for the essential plan. The D-SNP is going to be totally different, of course, because they don't have drug tiers. And I'm sure we all know that from our extensive D-SNP training, right? So that's just a grid to tell you how it works. Tiers 1 and 2, $0 copay. 3 and 4 will be 2 months worth for 90 days. And then the specialty tier, that's going to be a co-insurance. Generally, it's going to be 33%. And that will always be limited to a 30-day supply. So, Mark, if you can advance, the next slide should say product overviews, and we can skip that one and go right to slide 15. So the plans that we talked about, as I said, the Wellcare Extra Plus. The tagline for that plan really is for folks who need extra help, right? It is a D-SNP. So it's going to be for people that have full Medicaid or qualify for Quimby, Quimby Plus, or Slim B Plus only. So make note, if someone is just Slim B and no other benefit, they would not qualify for this, okay? The SEP is staying the same this year as it did last year. They moved to quarterly. So they would have a quarterly SEP from quarters 1 through 3, as long as they do qualify for Medicaid, a low-income subsidy, or a Medicare savings program. So you can enroll them year-round. That is a wonderful thing. Obviously, in the fourth quarter, it would be the AEP enrollment, not one of the SEPs. So that is our Extra Plus. That is our D-SNP. If we go to the next plan on page 16, Mark, our Wellcare Essential, like I said, that is our one-size-fits-all. This is sort of your basics in an MAPD plan. You want a little bit more than original Medicare, but maybe don't want to or can't afford to pay for a premium plan. Okay, it's going to have mid-range drug costs, and basically it's for people that want more than original Medicare. They want the dental, vision, and hearing, and some other of the other ancillary benefits without having to pay an additional premium. So that is what that plan is for. It is one of our most popular plans. Mark, if we can advance to some of the cool things that are going on next year for member discounts. So we, all of our members will have a discount on the medical alert system. So that's the brand we have is LifeStation. That's the the button or something you can wear around your neck and hit it if you have a medical emergency. I'm not sure what the undiscounted amount is, but our members can get that service for $22.65 a month. Great selling point there. We also will have healthy lifestyle discounts, right? We want our members to not only be taking care of their body and mind, but that'll help them be healthy, stay active, stay socially active. We want people to stay fit, right? Take care of themselves. So we will give up to $30 or 30% discount on alternative medical practitioners. Okay, so that would be acupuncturists, chiropractors, nutrition counselors, personal trainers, and more. It's just really a wonderful benefit. Okay, and members can learn about this online. They log into their secure online portal. There's all kinds of information about what is available, how they can do that. There's a reference library. They can do some research on their own. It's just a great product to have. And we, like I said, we want everyone to stay healthy, not just physically, but mentally as well. They do go hand in hand. And then we also have a program called OTC for Me. And that would be a discount program for our over-the-counter products. Members are eligible for a 20% discount on their first order if they utilize this program, and then 10% discount on every order after. So that is, people that are utilizing that OTC benefit a lot, this would be a great point to bring up. And any order over $25 will receive free shipping. So again, someone that's utilizing it a lot, they're routinely spending $21, $22. Advise them to spend a couple more bucks and get the free shipping. Okay, and it is a huge over-the-counter catalog. There's over 500 items in it. So that is a great benefit that is on both plans in the Toledo area. Mark, if we could go to the next slide. Member discounts again. So this LifeMart member discount program. LifeMart, if you don't know what that is or haven't heard of it, it's sort of like, I'm sure everyone has bought or at least seen those big, huge coupon books that, the local football team sells or the cheerleading team. It's, 1,000 pages with all kinds of coupons to local restaurants and services and things like that. That's sort of what this LifeMart is. It gives our members access to literally thousands of deals on brand name products and services. And they can search by name, by product. There's all kinds of things in there. I looked it up myself, and there's some basic things like, okay, an AT&T discount, 10% off your monthly bill if you go through LifeMart, to buying tickets to the Super Bowl. Okay, so there's all kinds of things in there that our members can get discounts on. Some of them are pretty arcane. It's pretty interesting. Oil changes, gym memberships, other. It's really cool actually to go in there and just see what they can get discounts on. Rental cars, hotels. It's pretty cool. So that is what the LifeMart is. Mark, if we could advance, please. We will have new hearing and vision vendors in 2020. So our vision vendor will be a vendor called Premier Vision. And our hearing vendor is Hear USA. Both of those are national, huge vendors. You can search for them online. As far as Hear USA, they've got over 250 hearing centers throughout the U.S. Okay, they've got more than 4,000 providers. And they are a preferred provider, actually, of AARP for the hearing care program. Not that means anything, here or there for us, but they are a very well-known and recognized hearing vendor. Okay, so that is what is happening on the vendor side of things that are going to be changing. As we go to the next slide, our dental vendor, we are still going to be with DentaQuest throughout the year. They've been our partner for the past 4 years. That is not going to stay. Mark, if we go to the over-the-counter, here's the information or the phone number for Field Techs. That will be our over-the-counter provider. For all of those wonderful things I mentioned earlier. And then if we go to the Wellcare meal benefit on slide 22, we will be partnering, or this is the second year we're partnering with a company called Mom's Meals. You may have heard of them. The way our benefit works is after someone has been hospitalized inpatient for 72 hours, they are eligible to receive 14 meals at home. Okay, so it's a per admission benefit, and there is prior authorization that's required. But basically, the idea is to take one burden off of our members when they get out of the hospital. So how this works is it's 2 meals a day for 7 days. They are shipped all at once. Okay, it is I would say frozen fresh food. They make it, they freeze it, they ship it out, and so it can last longer than 7 days if they don't eat both meals per day. But that's how that works. After 60 days, if they go back in the hospital again for 72 hours, they would be eligible for another round of the 14 meals. So that is, like I said, just something to make life a little bit easier. If you've been in the hospital, you get home, you at least don't have to worry about a couple of meals for the first week you're home. We go to the next slide, the Silver and Fit. They have also been our partner now for the past 4 years. All of our plans across the board in all of our regions do have the Silver and Fit gym membership benefit. Members do have an option. They don't have to go to the gym. They can get home fitness kits. They will send them up to 2 kits per year. The only caveat to that is a member cannot be enrolled in the gym side of the membership at the same month that they would order a home fitness kit. So that's just how that works, but they can make a switch up to twice a year. There's over 8,000 participating centers. This is just an example of some of the big names that, the nationally recognized names that participate: LA Fitness, Lifetime Fitness, Powerhouse, Anytime, YMCA, and Curves. For a more complete look and by area and zip code, silverandfit.com is that website. So if someone is interested during the enrollment, they want some more questions about that, just go right to silverandfit.com. You can search locally within 5, 10, 20, 50-mile radius, that type of thing, to find participating gyms. So that is really it as far as what is happening as we move into 2020. Mark, if you could go to the second to last slide there, the product launch. Some of these have already happened, and this actually is not that accurate. We do have some launch meetings in Toledo. We'll have them in Cleveland and Cincinnati. If you are, in the South Michigan, North Ohio area, and you want to come in the product launches in Michigan, by all means you can. We will be having 2 kickoffs in Michigan. I believe we're only having a Cleveland and Cincinnati one. So if you are in the Toledo area and you want to come to one of our kickoffs, the one you would want to come to in the Detroit area is on September 25th. That will be at the Westin Southfield at 6 p.m. It's a great time. Great food, great drink, free drinks, free food, opportunity to win a bunch of prizes. And then, Mark, if you could go to Stephanie's contact info. So currently our Ohio sales manager, she's also the sales manager for Michigan. Her name is Stephanie Finolio. That is her contact information there. So you might want to take a screenshot or a photo of that slide. She is handling Ohio right now as well. She can answer, some more in-depth questions regarding specific types of services or network things. But that is pretty much what is going on in Toledo. Mark, I think that pretty much covers what I was going to cover. And again, I apologize.
Very good.
I apologize for the mix-up earlier. We're kind of running around here. It was last minute that I was going to be on here, and I had trouble finding a conference room where I could stay in for the whole hour. So anyways, thank you for your patience, and I apologize.
Thank you, Bill. And I'm going to wait here just a second to see if any of the attendees have any questions. And so far,
sure.
Nothing. So with that, Bill, I want to thank you for taking time with us today. And I want to thank everybody who took time out of their day to attend. Great products, very strong benefits. And again, Bill, because of the POS option, I don't think the ProMedica issue really is significant with regard to the Wellcare products and the fact that they are, in fact, very strong in the greater Toledo area. So with that being, I want to thank everybody. And, Bill, thank you. And we will talk to everybody real soon. Take care,
All right,
folks.
Mark, thank
Bye-bye.
you. Okay.
Mm-hmm.